Ron Gurley, president of the National Alliance for Mental Illness in Dona Ana County, says mental health services are at a crisis point in southern New Mexico.
The demand keeps increasing, the resources keep decreasing, and I think finally, as an end result of this, we're able to get one of the federal clinics who have infrastructure, who are already in place, who are not for profit. I think we've got a chance to make some real progress. We've got pieces that some others don't have, but if we can connect all of those pieces, we're going to be in good shape.
La Clinica de Familia hasn't operated mental health services before. CEO Susan Martinez de Gonzalez says they are confident they will be able to provide the necessary services by keeping on the staff from La Frontera. She says they are working closely with the agency to help ensure a smooth transition.
Did we learn anything from the last one? Yes, we want to make sure that the client's files are where they are and that they know that they have access to them. The clients have to know where they're going for their services. There can't be a lot of questions. We want to really make sure this transition goes smoothly. And again, it's totally dependent on the staff. If the staff moves with their clients, that's going to help the transition so much.
Dona Ana County Commissioner Wayne Hancock helped organize a meeting of all interested parties to make sure that everyone's concerns were heard and could be addressed.
I know a lot of the questions that I received were about records being lost, people having to fill things out over again, computer systems that connect to each other. Are we dropping off some of the services? There have been a lot of services that kind of went by the wayside here in the last couple of years. And as you heard, we think that those services should be brought back up, that the levels brought back up to meet the community's needs.
Martinez de Gonzalez says they hope to do just that.
We're going to be looking at what the services they inherited in the first place, what they were, and so that seeing if we could be funded at a similar level so that we can start bringing the services back to the community.
She says that La Frontera has been helpful during this transition process.
This process is coming along, and I think that the cooperation with the agency is really needed. So not only for the staff, but especially for the patients and the clients that we're going to be bringing over. And they've been totally cooperative.
During the meeting, many expressed support of La Clinica de Familia taking over these services because they are a trusted local organization. New Mexico State Senator Mary Kay Papin says she thinks this will help them succeed.
It's been a very difficult transition that went from the providers to the new providers. So I'm very anxious that this go around that we will be going with the new provider in La Clinica, who has a proven track record in our community dealing with our people, that they will be able to handle these services and step up to the plate and do that.
Martinez de Gonzalez also says that being a local organization will help them in taking over these services.
We have been in the community since 1978. This is our home. We're not going anywhere. You know where to find us. Our board and the management team at La Clinica are totally committed to bringing these services on, mainly so we can have a continuity of care for our clients, and a number of the clients that La Frontera has are La Clinica de Familia's patients already.
La Frontera agreed to stay in Las Cruces and Anthony until La Clinica de Familia can take over. The transition date is set for July 31st. For KRWG, I'm Samantha Sonner.